Have you ever thought of legally changing your sex to get cheaper car insurance? A gentleman in Canada did just that. In the past, biological sex and gender was not as major a topic as it is today. Hello everyone, my name is Karon and I'm the CEO of XYZ Hospital. Nurses today have to be particularly sensitive with patients, especially when having to treat the biological sex of patients, but they identify themselves with the opposite gender. The terms sex and gender are sometimes used interchangeable, and they do in fact complement each other. They nonetheless refer to different aspects of what it means to be a woman or man in any society. The term sex refers to the biological differences between males and females. For instance, the male and female genitalia, both internal and external, are different. Similarly, the levels and the types of hormones present in male and female bodies are different. Genetic factors determine the sex of an individual. Women have 46 chromosomes, including 2 X's, and men have 46, including an X and a Y. The Y chromosome is dominant and carries the signal for the embryo to begin growing testes. Both men and women have testosterone, estrogen, and progesterone. However, women have higher levels of estrogen and progesterone, and men have higher levels of testosterone. The term gender tends to denote the social and cultural role of each sex within a given society, rather than purely being assigned by genetics, as sex differences generally are. People often develop their gender roles in response to their environment, including family interactions, the media, peers, and education. The gender order, often implying that women are less valued and influential than men, helps explaining gender bias. Gender bias means unintended but systematic neglect for either men or women. Exaggeration of observed sex and gender differences can also lead to gender bias. Gender blindness and stereotype preconceptions about men and women are identified as key causes to gender bias. But gender also refers to a person's self-representation as a male or female, or how that person is responded to by social institutions based on individuals' gender presentation. The concept of gender also refers to the constantly ongoing social construction of what is considered feminine and masculine, and is based on power and social cultural norms about women and men. The degree of decision-making and financial responsibility expected of each gender, and the time that women or men are expected to spend on homemaking and rearing children, varies between cultures. Within the wider culture, families too have their norms. Biological and social aspects are related, and the explanation of a patient's health problem can seldom be ascribed to only one of the categories. Therefore, gender roles are not set in stone. In many societies, men are increasingly taking on roles traditionally seen as belonging to women, and women are playing the parts previously assigned mostly to men. In medicine, the difference between sex and gender might create problems with the medical staff. The nurse that is attending has to be able to treat the biological side, but has to also address the problem of the gender side without being unsensitive to the situation and the patient. Gender is constantly created in interaction between people. We are all doing gender. In the patient-doctor interaction, the patient is doing gender by presenting herself or himself in line with what is seen as acceptable for each gender, and the male or female doctor does the same. Research indicates that physicians are more likely to interpret men's symptoms as organic and women's as psychosocial, and female patients are assigned more nonspecific symptom diagnosis. Women are also prescribed more psychoactive drugs than men. In a retrospective study of intensive care use, Large disparities were found between men and women. Specifically, older women, older than 50, were less likely than older men with similar severity of illness and age were admitted to intensive care units or receiving life-saving interventions. In a large variety of conditions such as coronary artery disease, Parkinson's disease, irritable bowel syndrome, neck pain, knee joint arthrosis, and tuberculosis, men are investigated and treated more extensively than women with the same severity of symptoms. When dealing with mental health, sex and women, the women are twice as likely as men to experience depression, with some women experiencing mood symptoms related to hormone changes during puberty, pregnancy, or premenopause. But with gender, the women are more likely to admit negative mood states and to seek treatment for mental health issues, in contrast to men. Biologically, osteoporosis is more common in women because they have less bone tissue than men and experience a rapid phase of bone loss due to hormonal changes at menopause. Gender-wise, osteoporosis in men older than 50 can go undetected and is often undertreated because patients and providers think of osteoporosis as a woman's disease. Despite the many publications about gender bias in treatment and investigations of cardiovascular diseases, inappropriate treatment of women is regularly reported even today. Furthermore, we once learned about differences between populations of men and women. A new kind of risk occurs on the individual level, the risk of knowledge-mediated bias. Although more knowledge is crucial to eradicate mistreatment and bias as a result of gender blindness and ignorance, availability of facts and information is no safeguard against bias. Acknowledging that gender bias exists, that it may consciously or subconsciously influence not only physicians' decisions making, but our own, and monitoring for it in our everyday practice would represent a good starting point toward halting its influence. When instances of gender bias are confirmed, these need to be identified and communicated to all stewards of patient care and shown how to correct it. A hospital's critical care nurses can instigate an approach to eliminating this problem in at least three ways: by recognition, identification, and mitigation. Research grants need to be allocated for studies about cognitive, behavioral, and communication processes creating gender bias. XYZ Hospital will have to have all staff that will need to undergo mandatory training to fully learn the difference between sex and gender and how to be non-biased when it comes to treatment of men and women. So therefore, new policies will be forthcoming and be put into place for all staff. Thank you very much for your time. I hope you enjoyed the video and enjoyed learning about being non-biased regarding sex and gender. Thank you for everyone for watching.